All right, let's see if we can get the ball rolling here. So far, we're doing okay. I'm assuming that you all can hear me? Okay. This isn't so much for this audience, but we try to record these for folks who can't make it. Um, so I guess I won't need this. The most important thing to say is welcome. I'm really glad to see you all. I look forward to these every year, and people always speak highly of them when they're over. So I'm glad to see you. When you get a chance, make sure you say hello to our external advisors, Dr. Rizzo from Nebraska, and Dr. Dudley from Minnesota. Wave your happy hands so people can see who you are. And okay, good. And make sure you chat them up. And I'm also very delighted to have my friend Paula Vermeer here, who'll be talking in just a few minutes. So my job is just to um, warm up the crowd and give you a couple of housekeeping details and just a little bit of orientation. For starters, you probably know that most important thing, the restrooms are around the corner. So, and they are opposite Prairie Rose, where you can get some coffee, and there'll be lunch and some refreshments later. I'm hoping everybody was able to use the parking decal and take a little picture with your phone. So far, that works. Seems to have worked pretty well. Um, great, great. Then what I'm going to do is just give you a little overview of what I hope we want to do today. And I'm assuming that one of these keys is going to let me do that, or maybe it's this. I don't know. Let's see. Oh, yes. Does it need a cup of coffee or something? Or okay, okay. I can relate. There's really three important things for you to remember, and they're easy to remember. And basically, they're just all in the brochure. And they're really all on the first page. And what they are is the website for Transcend, the Pathfinder address as well, and the emails for everybody who's here. Okay. And I think with those things, you should be able to really follow along. And by that, I mean, there should be the tools for everything that you want to do going forward. So if what you want to do is work on a grant application, you want to get some help in writing a paper, you want to get some help in finding a collaborator, they're all there, okay? So for example, in the web portal, there are over 200 people who have signed up with their contact information and their areas of expertise. So if you're trying to find a collaborator, go to the portal. If that is not satisfying to you, go to the Transcend website, and our navigator, whose job is 100% to help you find collaborators, will help you do that. And also, all the core leaders and all the cores have their addresses as well. So there you go. You probably know, for those of you who are new to Transcend or haven't been here last year, Transcend is an acronym for Translational Science Engaging North Dakota. It is a 5-year clinical and translational grant courtesy of the National Institute for General Medical Sciences. Our partners are obviously NDSU, UND, and Sanford Health, the largest integrated healthcare provider in all of the Dakotas. The goal of Transcend is to increase the pool of independent clinical and translational investigators in North Dakota. And this is really key because what Transcend is it's really a workforce development grant masquerading as a scientific grant. And I say that not to be critical, but the goal of Transcend and the metric by which it will be renewed or not is How many investigators have you been able to generate who are, by NIH standards, independent investigators, persons capable of supporting their own work through extramural funds, usually government forces? Um, so again, what we try and help everyone to do is to provide expertise and practice in research and training. And we do that via, among other things, pilot and developmental awards. Transcend distributes $500,000 a year in pilot and developmental grants, and will provide all interested persons with the expertise needed to develop those grants. So we're there to provide you with statistical help. We're there to provide you with career coaching. We're there to provide you with editing. And our goal and your goal really is the same. We want you to be successful. And if you're successful, then Transcend will be successful in the next iteration. So we really, we're partners in this, and we're really happy to help you. What is it you can study? Well, Transcend is a CTR grant focused in North Dakota. And therefore, the focus of this grant, per NIH requirements, is that we study problems that affect us and or affect neighboring areas. So examples of these are endemic diseases. North Dakota is second or third for colorectal cancer incidence and mortality. We don't know why. Very high rates of suicide in North Dakota. Number one in workplace accidents. And these are because lots of very untrained people have been going out to the oil rigs, and lack of training and dangerous work together are a bad combination. Not just endemic diseases, but endemic exposures are important. You can study pesticides, nitrates, radon. We have a number of folks working on radon because North Dakota is the most radioactive state, and Grand Forks County in particular is the most radioactive county in the most radioactive states. Special populations. You want to study indigenous populations, veterans, individuals who are at risk for particular outcomes or exposures. That's perfect. Also, I would say what is very attractive and will be attractive to future grants are what I would call medical puzzles. For some reason, and I don't know what it is, and I wish I did, North Dakota has the highest incidence and mortality for thyroid cancer. That makes 0 sense. That's because most thyroid cancer is a disease of overdiagnosis. People overuse ultrasound and overemploy endocrinologists. We don't have a lot of endocrinologists. We don't have a lot of ultrasound. Why we could be second or third for thyroid cancer and number one in mortality for this disease, which is rarely fatal, is really, really counterintuitive. And the reason that solving that is important is that thyroid cancer is the cancer of greatest increase in incidence, period, over the past 20 or 30 years. So it really, it's a puzzle waiting to be solved. Okay. What are approaches to solving these problems? There are many. No matter what your background is, you could have a role in Transcend. So the commonest phenotype, let's just say, of grant applications are clinician, non-clinician partnerships. You can find a partner, if you don't have one, in the Transcend portal, which is on page 2. Over 200 folks are signed up in there. Data repository research. This is legit if the patients in it are unique patients and have provided consent. The key to getting ahead in a lot of things in a state in which we are a community-based medical school, that is, we do not directly employ our own physicians, is prevention research, because you can study healthy people and prevent disease, and you don't need access to clinical samples. Community engaged research. We have an entire section of the Transcend personnel for community outreach and engagement. They can help you find your peeps. laboratory studies, these also qualify if the samples come from identifiable persons with informed consent. Okay, and just to show you that these are just not some theoretical examples, I want to give you a very brief example of each one of these. And I'm going to give you an example from radon, not just because I work in it and I'm lazy, but because it shows you that if you take a single point, you can draw an infinite number of lines through it, depending on what your interests are. So for example, working with Dave Schmitz, we were able to approach smokers. You probably know that if you're exposed to radon and smoke, you are 10 times more likely to develop lung cancer than if you were just exposed to smoking alone. So that in North Dakota, homes with 20 picocuries of radon are common. If you're exposed to 20 picocuries of radon, you're a smoker, your risk of lung cancer is 1 in 4. If you want to prevent cancer, well, cut to the chase and go to smokers. So Dave and team went to the quit line where smokers call trying to quit tobacco and did an intervention in which we quantified how likely is it that smokers would use a free radon test if they got it. The answer is very likely. The answer is very likely. And the conclusion of that is that North Dakota was the first state to offer free radon testing to smokers in the world, because every state in the US has a quit line, and in Canada, and every province. And now many other places are taking North Dakota's lead. Similarly, Mark Williamson, wave your happy hands, and group recently showed in JAMA, published in April, that women living in homes with high levels of radon were significantly likely to develop and to die of ovarian cancer. And that's incredibly important because there's no way to prevent ovarian cancer short of taking out a woman's ovaries and fallopian tubes. One can study prevention research. And a good example of that is Soo-Jung Kim's group, who's here, who've worked on actual clinical trials of different methods to get people to test for radon. And that work is publishable in real cancer clinical trial journals like Cancer Medicine. Similarly, we have ongoing research with Sydney Ray, working with women with newborns. Because if you're a psychologist, you probably know that the best chance to get somebody to change their behavior is at certain points in their lives when they're, oh my gosh, what do I do now? And having a child is one of those. Laboratory studies, for sure, even these are doable, and they can be done with, in many cases, already recorded data. This is a study showing that hematologic profiles differ in high, medium, and low radon zones, also from the Women's Health Initiative. And the important thing about this is that every single one of these studies was grant supported. So this is not just sort of a wish list. Oh, I wish I could. No, you can. You can. And what the next slide really ought to be is your study here. Okay? Because your study could be here, and I hope next year that it is. So before I give you the opportunity to hear from other people's studies, and you'll hear from funded studies in a lengthier format and studies that are ongoing in more of a speed dating format, I want to just take a second and thank the NIH for their support. I want to thank all the Transcend investigators for the effort that it goes into putting these things together, and our external advisors, and of course, everybody here today, and my friend, Dr. Vermeer, who will be up in just a moment. I want to point out shamelessly that Dr. Vermeer was a previous recipient of one of the pilot grants through the NIGMS program. Before Transcend, we had a North Dakota, South Dakota teamwork group, and I see several folks here from South Dakota, and I'm happy to see you. And at that time, one of the pilot grants went to Pei. She is an independent, established investigator and a fascinating speaker, and I'm really glad to have her. So I would just use this as a segue to point out that Dr. Vermeer got her PhD at Columbia in developmental neurobiology. She's runs a lab at Stanford, and the focus is on the neural regulation of cancer. And I'm really happy to hand over the podium to Pei.